Right, I think I'm live on the YouTube. I've got software which actually links to Facebook, but it's not linking. So I'm trying to go live on Facebook directly. Answering your question. I'm going to fill in the form. Answering your questions. Save. Oh my God, am I live on Instagram as well? Yes. Oh, crikey. Go live. So it's currently the 19th of August in the year of our Lord 2025, and we've got a community update on the TikTok. Got the community update. If you've got any questions, please live video starting, please ask away, and if you haven't, please just carry on what you're doing, basically. So I'm going to go through the questions that I've got, and I'm going to start with this one, even though things are whirling around. Instagram, solid as a rock. The tube is working. The book and the talk, not so much. But anyway, let's not wait for those people at the expense of all of my YouTube and Instagram followers, shall we? Yes. Okay. So this is the first question. Here we go. What type of skin cancers do you most commonly treat? So you can probably treat pretty much any skin cancer, but the skin cancer that we most commonly treat is the skin cancer that is most commonly, which is the BCC, basal cell carcinoma, also known as a rodent ulcer. These are the most common types of skin cancer, and they're a nuisance, little spots that don't heal up, often commonly in sun-exposed areas, or they can occur anywhere. The older you are, the more likely you to get one, because it's from chronic sun exposure, and relatively easy to treat in that they require excision. The treatment is largely surgical, and when they're completely excised, then they are cured. So in terms of cancers, are relatively benign. That's not really shouldn't really say a benign cancer, because that completely doesn't make sense. But not too aggressive as a rule, and tend not to do great harm unless you neglect them. If you neglect them, or if you have them in difficult areas like around your eye, around the nose, difficult areas with sensitive structures like eyelids and lips, for instance, cartilage of your nose, then they can be a little bit more difficult to reconstruct, but nonetheless still eminently treatable. So basal cell carcinoma, I would say, is the most common skin cancer that we treat. How do you know how deep to go when removing a sinister lesion? Right, well, the answer to that is that most lesions are skin lesions, and so we take the full thickness of the skin away, and it is that's sufficient. You just need to get the whole full thickness of the skin. Sometimes you take a little bit of subcutaneous fat, but you just need to take the full thickness of the skin. And unless you have a particularly aggressive tumor that is invading deeply, and you would probably see that when you do the excision, you will probably see that you're going through it, and then you maybe take a separate specimen at the deep margin, but that's not common. You would commonly just take a little rim of subcutaneous fat. So and most lesions are confined to the skin, so that's usually sufficient, but we would send it away for histology to make sure that we have got it clear on the deep margin, because when you remove a skin cancer, you have to have it clear peripherally and deep. So there, there is a risk that you might not get it clear on the deep margin, but we aim to, it's usually the peripheral margin that you've got to be a bit aware of in order getting a complete excision. I say usually, it's perfectly possible to get an incompletely excised skin cancer on the deep margin too. But yeah, so how do you know? I mean, basically we just take a margin of the lesion, and as I say, that usually requires just taking a little bit of subcutaneous fat, which usually doesn't cause much morbidity, because if you're bringing the wound together, then that doesn't matter how deep you go, really, because you're bringing it together. If you're putting a skin graft on it, then yes, that might make a difference, because the deeper you go, the more tissue you remove, the bigger the dent you're going to get. But don't commonly do skin grafts. We would tend to do a direct closure, which means basically stitching it together, or a local flap if it was too big to be stitched together. My preference certainly is a local flap. I don't think skin grafts look particularly good. They're good for big lesions or lesions that you're not sure if you've got them all out. They certainly definitely have a place, skin grafts, but cosmetically speaking, local flaps are usually better. And if you're using a local flap, that means moving a bit of skin from next door into the defect. And so again, it doesn't matter how deep you go, because the skin that you move into the defect will be the same depth as the skin that you've removed. So yeah, we just take a cuff of subcutaneous fat usually. What are the warning signs that a mole might be? I've got to be honest. TikTok is heavily dance, isn't it? Dance kind of, or is that just my TikTok? Whenever I go on, there's people dancing in the living room. So I'm not sure if I'm doing the right thing by just doing a Q&A. But anyway, I'm just as God made me, so I am just doing what I know how to do, which is Q's and A's. Well, A's mainly. The Q's are coming from you. So, sorry, what was the question? So the question was, what are the warning signs that a mole might be malignant? I guess the simple word is change. One word, change. If a mole changes, then I think you've got to be, think about it and seek advice. So speak to GP, basically, or you can send us a photo or get in touch with us. But you need to see a doctor if a mole's changing, and that can mean changing in the size. And so a change means bigger or smaller. It can sort of change either way. It means changing in the color, and again, that can mean darker or lighter. So again, either way. Certainly with skin cancers, with melanomas, there's a thing called regression, where they actually become less dark and smaller, and that's a sign of regression, which is actually a kind of bad sign when you see it histologically, because we don't know how big it was. But yeah, so a change in size or color, a change in the border. You want to see a nice crisp border around your mole. If the border becomes blurred, a bit more indistinct, then that's a bad sign. Certainly if you get any symptoms, things like bleeding or itching, that's definitely something that you need to think about. But sometimes raised moles, you sort of, because they're raised, you catch them and scratch them and they bleed. That's a little bit different. If it's kind of bleeding spontaneously, so bleeding without you scratching them, that's kind of a bad thing. And any sort of redness around it, any halo. Sometimes you get a halo, sort of depigmented area around the mole. Any little satellite lesions, any little smaller moles that appear around it. So essentially just looking for changes in your moles and if anything changes, it doesn't necessarily mean it's bad. It just means you need to get someone to have a look at it, which probably would be a GP. But as I say, it could be. You can send us a photo, and you can come and see us if you want, if you're concerned. How many skin cancer surgeries have you performed? Well, when you're training in plastic surgery, you do an awful lot. So, for instance, nowadays, for me, doing 4 cases in a day would be a big day. I think I've got 4 cases tomorrow. So, doing 4 cases in a day is a big day for me now. When you're training, when you're a trainee, you're looking at 4 cases in a morning, or maybe 6 cases or 8 cases. So you do a lot of this sort of stuff when you're training. And I have training, well, certainly in plastic surgery training, 6 years basically. You're like an SHO for probably a couple of years. So I guess 8 years training in, specifically in plastic surgery. That's on top of your general surgery training. And then as a consultant, I've been 5 years a consultant in the NHS, and then last 10, 11 years, maybe more than that, 12, I don't know. So 10 plus years in private. Anyway, so I don't know, but lots of skin cancer surgeries in that time. It's quite as I say, I'll be honest with you, the majority was when I was training in the as a consultant, and kind of in my more senior times, I've been doing stuff like breast surgery, breast reconstruction, and cosmetic breast surgery and things. And it's only more recently I've started going back to doing more of the minor procedures, the skin cancers and moles and cysts and lumps and bumps. And now I'm trying to do just do the minor procedures really. So I'm kind of going back to my roots. Yeah. Yeah, so doing more now. So how many have I performed all time? I don't know, hundreds. I do a logbook actually. You have to do a logbook when you're part of BARBs. Yeah. So is that helpful? So my main specialty was not skin, it was breast, but now I'm going back to doing more skin as I am now. So how likely is a cyst to come back after removal? Oh God, I think someone said something hold on a minute, I've got a white top and I can't read. What can be done to remove mylar bags, festoons? Hi Zoe. I think that's malar. Is it malar? So here, malar cheek, should we say? Let's not get too technical. So Zoe, I don't do facial plastic surgery. So that's my kind of disclaimer, if you like. So I don't do cosmetic facial anti-aging plastic surgery. So I don't do the sort of surgery to work on malar bags. But just in general terms, the sort of things that you can do for it would be a lower blepharoplasty stroke mid facelift. So blepharoplasty is tightening the eyelids. So upper blepharoplasty is tightening the upper eyelid. Lower blepharoplasty is tightening the lower eyelid. And I mean, this would depend on the surgeon. So it's a bit funny me talking about it because I wouldn't be doing it. But the sort of thing you can do to sort of get rid of fullness in the cheek area is to tighten it. You can tighten the skin there. There's a bit of a kind of difference of opinion or different schools of thought as to whether you add volume or take volume. I think people are. as I say, I'm not up with the latest. So, but I think people are more into adding volume now. There was a time when people were taking volume from the face, so they're taking away these fat pads. This, you're saying you've got sort of malar bags. You kind of naturally think, oh, I've got malar bags. I've got too much excess there, so I need to have it removed. And certainly that can be done to take some volume away from that area. But often when the skin is tightened, people are often now, I think, performing volume addition. If you have, basically, what we're looking for is we're basically trying to go back to look like a child, basically, or maybe not a child, but when you're younger, should we say, maybe a child's. But if you look at children's faces and sort of young people's faces, they're actually quite full. They're actually quite tight. They're not empty. And so people who've had a lot of cosmetic surgery in the face, especially when they've had a lot of volume removal, a lot of fat removal, can look a bit sunken and a bit skeletal. So I think that's something you've got to be careful about in terms of facial rejuvenation. So yeah, tightening the skin in with a sort of lower blepharoplasty stroke, sort of mid facelift to tighten that skin, and then doing something with the fat, maybe removing fat, maybe adding fat, but yeah, that's the sort of thing that's been done for malar bags or malar bags, yeah. But yeah, that it's kind of surgeon. I think surgeons all have opinions, but that's just broadly speaking what sort of thing gets done for that sort of stuff. Okay, so nice one, Zoe. Nice one for asking a question. It's good, isn't it? At least I'm not alone. So, how likely is a cyst? Thank you. Oh, you're welcome. How likely is a cyst to come back after removal? Well, not likely. I mean, there's different things you can do for cysts to get rid of them, and one is to when they burst and they look like they've gone, they pretty much always come back because the cyst wall remains. So probably the most effective way to remove a cyst is to surgically remove it, including the cyst wall. Now, if we get it out with all of the cyst wall, then we can say that it's all removed. But the problem before you do the surgery is you don't know that you're going to be able to get it all out with the cyst, including the cyst wall. So you have to warn people that if you can't get it all out, and if you can't get all that cyst wall out, and if you leave any behind, it can recur. So there is a chance for a cyst to recur, but it's not likely and it's not common. And usually, I would say 90%. Well, is that hard? Is that too high? 80, 90% of the time, you would get it out with the whole cyst wall completely. Maybe not intact. Often the cyst wall breaks when you're taking it out, because especially if you're trying to take it out through a slightly smaller incision, because you're kind of pushing and pulling it. But usually, you get all of the cyst wall out, so you get it out completely. And when you get all of the cyst wall out completely, it's cured and it won't come back. Occasionally, it kind of breaks apart and it comes out kind of piecemeal. And so in those circumstances, you might have a situation where it could come back and you might have to do it again. That is a risk. In fact, I did one last week. I think I had to do it again because it came out. I think the first time it was a bit infected. Was it? I can't remember why I didn't get it all out first time. That's usually the case. Usually a bit infected and it's all a bit soft and it comes out piecemeal. Usually. But anyway, yeah, it's not that likely, but we don't charge you if we have to do it again. And it will come back after a few months, usually, if it's going to come back. I forgot to say, I have many smallish lipomas. What is the best method of removal? Sam Van. Hi, Sam. Regarding the removal of several lipomas, how best to remove them, avoiding numerous scars? Who's that? Susie. Right, Susie. Nice to see you, Sam Van. Hope it's all going well with your new venture. Well, Susie, yeah, multiple lipomas. Well, the only way I know is excision. And the problem with excision is, like you just said, multiple scars, because you don't want multiple scars. Completely understand that. But I don't know of any other way of removing it. I don't know if anyone's doing anything like injecting stuff to try and dissolve the fat or something like that. in my view, there's only one way to remove them. But the problem with doing that is you're trading your kind of annoying problem with your lipomas, which often isn't that bad cosmetically, because often you can't see them, into a cosmetic problem that you'll no longer have annoying lipomas, but you might have a cosmetic problem there because you'll have multiple scars. Now, often, not always, but often, when you have multiple lipomas, especially if they're underneath the skin, kind of quite close to the skin, and hopefully they are quite close to the skin, because if they're not quite close to the skin, they shouldn't be bothering you. So, usually the ones that are bothering you are quite close to the skin. So you can often take them out through just a little stab incision. So that means that the scars are not big, but if you've got multiple lipomas, they will be multiple. You will have multiple scars, and so I completely understand why you don't want to have that. But I don't know of another way of doing it without giving you those multiple scars. So if in my hands, it's a toss-up between having multiple scars or multiple lipomas, and it's maybe neither of those situations is great, but I don't know of any way of getting rid of them another way. At the moment, maybe they'll make something that you can do to get rid of them, but excision is really the only way to do it. But I completely understand it when you've got multiple. As I say, you often can just do tiny, it depends on how big your lipomas are, but you can often do kind of little stabs and then squeeze them out. So often you can not have massive scars, but it might look a bit odd if you've got multiple lipomas having sort of loads of scars. It might look like you've been through a car windscreen or something. So that's something to think about. Tricky one, that. Sorry, I haven't got any easy answers for that. Why can't you remove an infected cyst? Because it is two reasons. First of all, the wound's likely to get infected. So if there's infection in the area, you don't want to kind of make a surgical incision and get the cyst out, because the wound's likely to get infected. So that's number one reason. And number two reason is that you're very welcome, Susie, is that the cyst will be hard to remove. So having spoken earlier about cysts recurring, it's much more likely to recur when you remove an infected cyst, because it's kind of really soft. The cyst wall is really soft. It's not hard and nice and discreet, so you can't get it out like a marble. It's all breaks apart. So it's really hard to be convinced that you've got all of that cyst wall out. So those are the situations when you try and remove infected cysts, that they often recur because you're taking out the cyst wall in bits. And so if you kind of take out the cyst and it looks like bits on your trolley, then you think, right, I might not have removed it all. It might have to come back. But if it looks like a ball or has some resemblance to a ball, then you might think that you've got it all out. And so ideally you don't want to be doing the surgery when it's infected. The other thing about removing infected cyst is that the local anesthetic doesn't work very well when there's infection in the area. So it's just never a pleasant thing for anyone. It's not pleasant for the patient. It's not pleasant for the surgeon. As I say, the local doesn't work very well, and the surgery is just not very nice at all, because there's kind of bits and the local hasn't worked, and it's all friable and just really hard to get all of the cyst out. So it's just a no-go. So it's often people contact us and say, look, I've got an infected cyst, it's really bad, it's all inflamed, it's horrible, and we'll say, look, we can't help you. It sounds bad, but it's just not good for anyone. So you're better off getting the infection sorted, leaving it a month or two. Once it's all quiet, that's the time to remove the cyst, not when it's infected. You might need A&E, you might need antibiotics, you might need drainage. We tend not to get involved with any of those things. We get involved once the cyst has kind of settled down. So what you got? Shadab Alam. I want tattoo excision surgery. Yeah, well, my friend, you can have it. You want it? You got it. No, actually, well, it depends on the size and shape of your tattoo, Shadab. So your best bet is to send us a photo. You can do that by WhatsApp. There should be links somewhere. I try and put links in the video description sometimes when I do a tattoo excision video. So if there's a tattoo excision video of mine somewhere, then there should be a link to the WhatsApp with a WhatsApp number. Or you can email us info@staianoplasticsurgery.co.uk with a photo of your tattoo, and we'll let you know whether we can do it at all, because some tattoos we can't do. Big ones, basically big ones in bad areas like the shoulder or your back or something like that, without much spare skin. Your hand, there's some areas where they haven't got much spare skin, so you really can't really remove those. But if it is suitable for tattoo excision, then certainly we can let you know how much it will cost, how many sessions, because often you can't do it all in one session unless it's kind of long and thin. Long and thin ones are usually suitable, or more suitable, and may potentially be done in one session if there's enough skin laxity. But other ones, they can take multiple sessions. So we'll let you know about whether it's suitable or not, and certainly if it is suitable, then a lot of people do like excision because it's kind of like instant and it's kind of guaranteed. However, the thing you have to kind of acknowledge is that it will leave you a scar, Shadab. So that's the sort of good thing, is kind of guaranteed. If it's suitable, it's guaranteed, and often quicker, one session or so. We often get people who need to have it removed for their job, and so that's it's quite time sensitive, and so those so it is kind of pretty much instant, really. You walk in with your tattoo, you walk in with it, we walk out without it when it's suitable. So that's good, but as I say, the big issue, or the big reason that the majority of tattoos are not removed by excision, is that it will leave a scar. So we usually tell people to have a look at laser excision first. So we don't do laser. So if laser has failed, or if there's some reason that you think excision will be the way to go, please do get in touch. Send us a photo of your tattoo, and we will let you know whether it will be appropriate or not. But thanks for commenting on the live. That's good. That's good. Also, all right. So, yeah, if I was on the ball, I could put in the comments what the WhatsApp number was, but quite frankly, not on the ball, so I don't know what the WhatsApp number is. Sorry, Shadab, but I'm sure it'll be somewhere. I'm sure on the Facebook, not on the Facebook, on the website. I'm sure it's there. So that's it. If you've got any questions, then please ask now. Otherwise, I'm going to try my level best to do dinner. So, which I'm not looking forward to, I'll be honest with you. But still, so here we go. Chat on WhatsApp. What is that? Copy. You can send us a photo here. I'm not sure if that link will work. Anyway, hi. There's a link anyway. I think. Anyway, yeah, I just went to the website. Basically, went to the website, and there's a thing that says what on WhatsApp. Anyway, okay, so yeah. Anyway, gotta go. Must rush. Of a busy man, as you can well imagine. So yeah, next week I will no doubt be in the same place, right here. I suggest you do likewise. And but for now, I wish you a good night, and and adieu. Screen. Share. All right, TikTok. Much love. Lots of people here, which is good. Facebook, don't think it ever got started, I'll be honest. Okay. And YouTube. Good night, my friend.